Unless you've been living under a rock recently and missed it, there's a new virus causing quite a stir at the moment. In today's video, I'm going to go over the coronavirus outbreak, and my goal is to leave you with a fairly sophisticated understanding of what is going on here. But don't worry, I'm going to make sure that this is all explained in a way that is really easy to understand. Hey guys, welcome to the channel. My name is Atif Shahnawaz. I'm an internal medicine doctor, and I explain medical concepts in layman's terms. Please consider hitting that subscribe button if you'd like to get more content from this channel. So with respect to the coronavirus, I think a good way to begin understanding this is to think about the common cold. We've all gotten colds in the past, so we're all familiar with the symptoms. The cold is actually caused by one of four different virus families, and they are the paramyxoviruses, the adenoviruses, the rhinoviruses, and the coronaviruses. And so yes, that fourth one is the coronavirus. In fact, it is very likely that at some point in your life, you've had an infection caused by a member of the coronavirus family that resulted in symptoms that were just a common cold. In fact, the coronavirus causes common colds 10% of the time. However, the coronavirus that emerged in Wuhan, China is a new member of the coronavirus family that did not exist before. Now, this sort of thing isn't new or unique. Viruses evolve and they mutate constantly, and we discover new ones all the time. However, this new one is particularly nasty and it causes severe illness. Now, the medical speak for how nasty an infectious agent is virulence. So this coronavirus is highly virulent. Coronaviruses infect animals and humans alike, and a lot of the times, the type of coronavirus that infects humans does not infect animals and vice versa. However, there are times when the virus migrates from animals into humans, an event that is called cross-species transmission. Now, this is not the first time that a new coronavirus family member crossed species into humans. This has happened before. Back in 2003, also in China, patients started getting sick with cold or flu-like symptoms that would then sometimes progress to severe life-threatening pneumonia-like illnesses. Now, at first, it wasn't entirely clear what was causing this. The disease would spread rapidly, and it had a fairly high mortality rate of about 10%. Now, eventually, after some frantic testing and ruling out of a bunch of other organisms, it was understood that this disease was caused by a coronavirus. We think, but we're not entirely sure, that this coronavirus started infecting bats and civet cats. The animals would get sick, and their secretions, like saliva or feces, would come into contact with the humans that were handling them, resulting in the cross-species transmission. Now, this was the very first time that a coronavirus was identified as a cause of a pandemic. Now, before the coronavirus was identified back in 2003, the syndrome of illness was pretty much just named after the symptoms that it was causing. So back then, it was called the Severe Acute Respiratory Syndrome, or SARS. Now, we think that SARS killed almost 800 people before its spread was halted. And just to be clear, SARS was ended not because we found a cure, but because we managed to stop its spread. Now, eventually, all the people who had SARS either got better or they died, so this virus was eliminated from humans eventually. In 2012, a second coronavirus emerged, and this was different from the one that caused SARS. And this time it started in Saudi Arabia, and it started off in camels. This outbreak ended up being called the Middle Eastern Respiratory Syndrome virus, or MERS. And now we are currently at the third outbreak of a coronavirus infection, the one that came out of Wuhan, China. Now, all of these coronavirus infections, whether they be SARS or MERS or this new Wuhan virus, have very similar symptoms in infected patients. Most of the time, all the virus does is that it causes a cold or flu-like symptoms, just like we talked about in the beginning. So we're talking about the typical runny nose, coughing, fever, headache, body aches, congestion in the lungs, maybe a sore throat, etc. The kind of symptoms that we are all familiar with. However, in some people, the infection begins to affect the lungs in a very severe manner. And we're not just talking about lung congestion, which is a common part of the common cold. We are talking about severe lung inflammation and damage to the point where the patient's oxygen levels drop down dangerously. These patients have such a severe inflammatory reaction that they develop sepsis and shock. Now, I recently made a video about sepsis, so I will refer you to that video if you want to learn more about what sepsis is. But it is this involvement, this severe involvement of the lungs and the subsequent shock that causes deaths in coronavirus outbreaks. Now, we're not really sure why the lungs are affected so severely in some patients but not others, but we have noticed that patients who are elderly and frail to begin with, or they have weak immune system, have the highest probability of progression from cold symptoms to the more severe lung pathology. But keep in mind that the severe lung pathology can even happen to previously healthy patients. Now, I want you to appreciate how the symptoms of the coronavirus outbreak present such a huge challenge to healthcare systems, because if the coronavirus had some kind of a specific rash, or it had a very specific blood test result that resulted quickly, then it would be easy to quickly identify patients who had it and focus our healthcare efforts only on those patients. However, it's wintertime right now, and people in the winter, they get the common cold, they get influenza, they get seasonal allergies even, all of which could mimic the symptoms of a coronavirus infection. The result is that now anyone with cold-like symptoms in a place like Wuhan is now a potential coronavirus patient. Even if all they have is a common cold not caused by the coronavirus, the problem is that they will undoubtedly go to the hospital. So hundreds and thousands of people are flocking to the hospital there because they're all afraid that they have the virus, and this really strains the healthcare workers in any region where there is a coronavirus outbreak. If you've seen some of those viral videos of overwhelmed doctors in Wuhan and overcrowded hospitals, it's because there are so many people going in to be evaluated, and not because everyone who is there is actually sick with the coronavirus. Now, it's important to note that a large percentage of victims of SARS were actually healthcare professionals, because doctors and nurses, they were the group of people who were most exposed to the virus in hospitals. But another way of saying this is that the place that one is most likely to get infected with the coronavirus is a hospital with coronavirus patients in it. And this is an important point to note, because if patients are flocking to the hospital at the first sign of a cold-like illness, they're actually potentially putting themselves at greater risk. Because in sites like Wuhan, where there are hundreds, if not thousands of people with the actual coronavirus infection, the one place a person will definitely be exposing themselves to it is the hospital. So here's how I would think about this if I lived in Wuhan, or I lived in any place where there was an outbreak. If I did get a cold-like illness, I would first keep in mind that the large majority of patients with the coronavirus actually survive. So my first instinct wouldn't be to panic. I wouldn't also necessarily go straight to an already overcrowded hospital where I would spend hours waiting amidst dozens of other patients, some of whom would actually have the real virus. I would instead immediately isolate myself from friends, family, and coworkers, and then completely avoid public places so that I did not infect any other people. Most of the time, the illness manifests with cold-like symptoms. So if the symptoms are mild and they feel just like a regular cold, then I wouldn't do anything beyond the normal thing a person does when they have a cold, which is to get plenty of rest and drink lots of water. The time to seek professional medical attention is when it feels a lot worse than a common cold, and the patient will know when that is. Also, if I were to start having difficulty breathing, then it would be reasonable at that point to suspect that the coronavirus was now causing inflammation to the lungs, and then it would be worth the risk of going to the hospital and seeking treatment, because at that point, the risk of staying home would be greater. Now, let's also talk about what this treatment is. I've heard the word thrown a lot around on TV these days as people talk about the outbreak, and I think that it's causing a lot of misunderstanding. So let me be clear. There is no cure or definitive treatment for this virus. There's no antibiotic that will cure the infection, steroids don't help either, and neither do antiviral medications. By treatment, the only thing a doctor in a hospital will offer is what's called supportive treatment. And that means that the patient will be placed on oxygen, which will be critical because the lungs are so inflamed, they don't take in oxygen very well. And if the lungs get even worse in the days to come, the patient might be placed on a ventilator to prevent the oxygen levels from dropping even further. And this is called respiratory support. The second arm of treatment is to give a lot of IV fluids, because in severe sepsis, the blood pressure can drop quite a lot, and giving IV fluids will keep it up. And that's it. That is the extent of the treatment that we have for something like this. Essentially, we try our best to compensate for the severely diseased lungs and the shock and keep the patient's body going for long enough for the infection to run its course. Death can occur if the blood pressure won't stay up despite giving fluids, or if the oxygen levels won't stay up despite being on a ventilator, and that can happen. All right, so you're probably wondering what you can do to protect yourself from the coronavirus. And I'll say that the only thing that really helps is to avoid being around people who are infected. That is the single most important thing to do. So in places like Wuhan, where it is relatively widespread, the best thing to do is to avoid being in crowds where there might be an infected person. So staying home from work, minimizing time in stores or public transport is really important. We think that most of these respiratory viruses are spread from bodily secretions. So if a person sneezes or coughs, those droplets, even if they're really tiny and invisible, are inhaled by others. In a similar way, if those droplets land on some surface like a table or eating utensils, and then that surface is touched, then the virus is now in the patient's hands. And then if that hand were to be brought up to the nose or the mouth, it can complete the transmission. So hand hygiene, like washing hands regularly, especially if you're in an area where people are sick, is very important to prevent spread. And obviously, all of this also applies for the common cold and influenza as well. Now, you see a lot of people in China these days wearing masks, but the fact of the matter is that the evidence that a simple surgical mask is protective is lacking. Masks really, I think, fall into the category of, well, it can't hurt, so why not use it? And I don't really see anything wrong with that approach because they're also relatively cheap. I think masks make people who are wearing them feel a bit safer, but again, the evidence that they actually prevent infection is severely lacking. Now, medication-wise, there is no medication or supplement that has any strong evidence of being protective. So things like vitamin C, zinc, herbal teas, etc., they don't really do anything. Again, the best thing to do to avoid getting infected is to avoid crowds of people. And this is why healthcare officials are so concerned that the virus might spread to densely populated areas where people are constantly living in close proximity to one another, and that will really accelerate the spread. Now, let me also talk about the flu for a moment. The flu or influenza appears every year around winter. And just like every other year, it is amongst us this time of year as well. Now, while there are certain differences in the clinical symptoms, for all practical purposes, influenza, which is caused by a completely different virus, and the coronavirus illness present essentially the same way. And what I mean by that is that in areas of outbreaks, anyone who has symptoms that might be a flu needs to be considered for the coronavirus infection as well. Now, influenza regularly kills hundreds of thousands of people globally every single year. And there are those who are asking why there is such a fuss over the coronavirus outbreak when every year so many people are dying of the flu. After all, SARS and MERS killed only about 800 people throughout the entire course of those illnesses, whereas the flu has killed an estimated 350,000 people worldwide in 2017 alone. And this is a huge difference. But there's also a critical difference, though, between the flu and the coronavirus outbreaks, and that is the mortality rate. In other words, what is the percentage of people who die of the disease once they're infected? Now, to be fair, this can be a really tricky number to determine with accuracy because many cases go unreported. But we estimate that the flu in general has an estimated mortality rate of 0.13%. So 0.13. For SARS, the estimated mortality rate was almost 10%, so much higher. And in MERS, it was 35%, even higher than that. Now, there is legitimate debate to be had about how accurate these numbers really are. Is it 35? Is it 25? Is it 10? Or is it 15? So the important thing, however, is that there is an order of magnitude difference in the mortality rate of influenza versus the coronavirus outbreak. So if the coronavirus outbreak became as widespread as influenza, then the number of global deaths could easily reach many, many millions. And this is why the argument that flu kills more people and we shouldn't worry about the coronavirus as much, I think is an overly dismissive one. Having said that, though, unless you yourself are actually living in an area with a coronavirus outbreak, then yes, you personally should worry more about influenza than the coronavirus. But globally speaking, the global public health concern about the coronavirus is completely legitimate, and it has everything to do with the mortality rate. Now, I'm going to be following this closely in the weeks to come, and if I feel I have anything further to add to the conversation, I'll make another video about it. In the meantime, if you have any questions about anything that I've discussed here, if something wasn't clear, please put that down in the comments section and we will continue the conversation over there. As always, thank you so much for listening, and I will see you all in the next video.